Welcome everybody to today's webinar. First of all, I'm going to start off by doing a land acknowledgement before we get into the presentation today. So we respectfully acknowledge the province of Newfoundland and Labrador as the ancestral homelands of many diverse populations of Indigenous peoples who have contributed to 9,000 years of history, including the Beothuk on the island of Newfoundland. Today, this province is home to diverse populations of Indigenous and other people. We would also like to acknowledge with respect to diverse histories and cultures with the Mi'kmaq, the Innu, and the Inuit. So welcome to today's NLCHP and CLP NNL's Wednesday webinar. My name is Wanda Squires. I'm a licensed practical nurse practice consultant with the College of Licensed Practical Nurses. And I'm going to be the moderator for today's webinar. So before we get started into the presentation, I just wanted to discuss the importance, responsibility and accountability. So as health professionals, we are accountable and responsible to meet the standards of practice and our code of ethics in the profession in which we practice. So health professionals have a responsibility to maintain their physical, their mental, and emotional fitness to practice in order to provide safe, competent care to members of the public. So health professionals also have a responsibility to recognize when their mental and physical wellness are being compromised and to seek help and assistance to get back to that feeling and being well. So today we hope to offer guidance and support to health professionals to recognize when we are feeling and having symptoms of burnout fatigue. So I'd like to welcome Tessa Hayman, who's a registered nurse and a burnout recovery coach. After years of working as a registered nurse with a specialty in palliative care and experiencing burnout, Tessa has started her healing and recovery journey to have a better quality of life. As well as for the last several years, she has dedicated her time and energy full-time to burnout education and awareness while supporting and coaching health professionals to overcome and prevent burnout. She has been a guest speaker on numerous podcasts, YouTube shows, and summits, speaking up on the topic of burnout. This past July, she launched the first annual Burnout Recovery Summit for health professionals, which gathered experts from 6 countries to share their experiences and strategies for eliminating burnout and its symptoms. So I'd like to, on behalf of CLP&NL and the NLCHP, we'd like to welcome you, and I'm going to hand over the reins to you, and you can certainly share your screen.
Thank you so much for that, Wanda. I really appreciate the privilege of coming here to speak with you all today and share the wisdom that I have gathered over the last several years, as you mentioned. So I'm just going to share my screen here. Here we go. So today is all about burnout prevention tips. And as health professionals, we are in one of the top careers to be at risk for burnout. And so it's really important for us to have as many tools at our disposal and techniques that we can use to safeguard ourselves, because at the end of the day, it's your health and your well-being that, if compromised, can lead to compromising that in others as well. And when we're looking at burnout, there's a lot of myths and there's a lot of misinformation out there about what burnout is and what we can actually do about it. So to jump in right today, we're going to talk about what it is, what causes burnout, and we're also going to talk about some signs and symptoms that might be showing up for you in your personal, in your daily life, your personal life, or your professional life. And so when we look at burnout, burnout is really a combination of things. It isn't just one thing. It's a combination of our physical, emotional, and our spiritual bank accounts, so to speak. And for us, feelings of depletion or exhaustion might be the first thing that you notice. And that could be, you've gotten to sleep after your shift, but when you wake up, you don't feel refreshed. or you don't feel like you've had good quality sleep, or maybe you have a racing mind, thoughts that are making it harder for you to fall asleep or to stay asleep. And so that might be an example of how you are experiencing exhaustion, because day after day after day after day of having that, you're going to be run down. And that's going to affect a whole host of other symptoms in our body. Perhaps you find you're getting sick more often, or you're feeling you don't have the physical energy to do the tasks in your day-to-day life that you would normally. Maybe that's playing with your kids, or going out to see friends or family, or volunteering. You may not have the energy to do those things because you're depleted. A second sign of burnout is increased mental distance from our role, from our job. And this may be coming up as negativism, cynicism, or something we hear quite often in healthcare, which is compassion fatigue. And that often occurs. Sometimes it's a little bit more subtle and sometimes it's more obvious, but it often occurs, when we're really feeling stretched for resources. And that could be getting angry that we don't have supplies. That could be being upset that a patient is constantly on a call bell for pain medication. Even though we know they're in pain, we are so mentally distanced from our work that we just want them to stop ringing on the call bell. And again, this often comes side by side with depletion and exhaustion. These two typically go hand in hand very quickly. And so being aware of where this might be showing up for you in your individual practice. Perhaps it's, it shows up if you're a community nurse, maybe it shows up in your driving. Maybe it shows up in how ahead of time you give your patients notice that you're coming. If you're working in a clinic, maybe this is feeling like you never get support from your boss, or you're never getting proper direction from the administrative staff in your clinic. And then the last component of burnout, to really create this trifecta that we are dealing with, is feeling like you're not really accomplishing anything, not feeling the reward from nursing that maybe you once felt, or that you thought you would feel when you come into this profession, or as an allied health professional when you enter your profession. And so you may be feeling like you're not getting as many tasks done in your day, or you're not feeling like you're able to connect as deeply with your patients or with your coworkers. And so you're not able to do your job as efficiently, or able to keep goals that you have for yourself, making progress towards goals that maybe you have for your professional career, and you're not able to have those accomplishments. And so when we look at what causes burnout, as you can see from this list here, again, it's not just one thing. And the thing that is the biggest myth when we're looking at burnout is the myth that burnout is a problem. A problem has a solution. In this case, there is no one step or one single solution for burnout. And I'm sorry if that burst the bubble you came here hoping to hear, but I promise I have a number of things that I'm going to be sharing with you throughout this webinar that are going to support you to make some changes and prevent or help you to recover from burnout if you are experiencing it. And so by acknowledging that burnout is not a problem, we can ask the question of what is burnout? It's not just these three impacts that we see in our day-to-day life. It's a dilemma. And it's a dilemma between two horns. If you think of a bull, there are two horns here at work. And we have burnout as one horn, and the other horn is productivity. And when these two horns are not balanced, are not in harmony, we're going to tip towards burnout. And so this is a teeter-totter that requires lifelong management. Just like there are many other things in your professional career that you have to manage for the length of your career, burnout is one of them. And it has to do with these 6 causes. So number 1 is about workload. And oftentimes we may feel like we have little control over our workload. But our workload is actually something that we can impact. And that impact comes from communication with our management, communication with our administrative staff, communication with our college, with our associations or societies that are supporting us, and looking at whether the workload is appropriate. If it is, maybe there's skill development that needs to occur. If it isn't, perhaps we need to look at working with your specific employer to have an appropriate workload. We may need to advocate for legislation or advocate for our colleges or our associations to be involved and help to change the workload if possible. Number 2 is perceived lack of control. If we don't feel like we have control in our lives, we're going to be more prone to burnout. And that perceived lack of control can be in regards to our schedule. It can be in regards to the type of patients we're seeing. It can be in regards to our personal life. This is one of the areas where our personal life can deeply impact our professional life. And it can also be, do we feel like there is the ability for us to progress in our career? Or is that outside of our control? Number 3 is a lack of reward or recognition. This is essential to us simply as human beings, to be recognized for the work that we're doing, to be acknowledged, and to feel like we are valued. This is part of where that low degree of accomplishment or feeling like we're not as efficient or effective in our roles can start to mount, can increase, because we're not feeling recognized, we're not being acknowledged, and we don't have feedback on the work that we're doing. Number 4 is poor relationships. And poor relationships can mean poor relationships with your clients, with your patients, can mean poor relationships with your coworkers, or it can mean poor relationships in your home life. All of these are going to play a factor in how prone to burnout you are in your own profession. Number 5 is about a lack of fairness. And fairness can be in regards to feeling like vacations are not being divvied up, fairly, or that day off requests are not being fairly given, promotions or opportunities to advance in our career are not being equal in our workplace. And then the last is values mix match. And what this is talking about is how closely your personal job lines up with your personal values. And the greater these are different, the greater the difference between these two, the more likely you are to burn out. So if you just take a moment here to think about how these 6 causes may be impacting you in your workplace, you'll start to get an idea of whether or not you're at risk for burnout, or whether or not you're sliding fully into burnout, and how quickly you need to take action. So when we have, one of the things I want to address here is number 2, the perceived lack of control. And this takes us right into our next section of today, which is learned helplessness. When we consistently feel like we don't have control over our lives, this can condition us to feel helpless. And this is a state that occurs after we've experienced a stressful situation repeatedly. And this was first discovered Similar to the studies that were done with Pavlov's dogs, if you'll remember that from your psychology courses you likely took in school, your intro to psychology. This is what happened in this study was they had they did the study with dogs, and they had a dog in a cage, and in the cage they would electrocute the floor, and when the dog realized it couldn't escape and it was going to be electrocuted no matter where it moved in the cage, it just lied down. Now they took these dogs that had been electrocuted, and they took dogs that hadn't been electrocuted, their control, and they put them in a second cage. And in the second cage, there was a small half wall in between the two sides of the cage. And on one side of the cage, the floor was electrocuted. And on the other side, there was no electrical current. There was no shocks. Dogs that had not been in the first cage were placed on the side with the shocks and immediately jumped over the half wall to the side without shocks. The dogs that had previously been electrocuted were put on the side of the cage with shocks. And when the electricity was applied, instead of trying to jump over the wall, they could see the wall was there, but they didn't even try. They just laid down immediately. So this can happen to us in our workplace if we believe that we are unable to control or change our situation. And then when that happens consistently over a period of time, we stop trying. Even when circumstances change, even when opportunities become available, we don't even try, because we've been conditioned over months, weeks, years, decades, in some of our cases, to feel helpless. But the truth is, we are not helpless, and we are never helpless. And we do have the power to affect change in our lives and in our career. Whether we need to join together as forces with our community, with our coworkers, with our family, to get out of a pattern of helplessness, if that's something that you feel has personally impacted you, is a consideration. But it's once we have gotten the resources of support, change is inevitable. And so if the only thing you get out of today is that you are never truly helpless, I hope that stays with you, because opportunities constantly come, and the best thing you can do is keep awareness for them and do what's in your power today to build those opportunities, whether it's reaching out for help from your coworkers or from your management, whether that's reaching out support from a spouse or from parents or siblings or extended members of your community, whether that is looking for opportunities within policy or within your support organizations to change circumstances. Opportunities are always coming to you. It's, are you becoming aware of them? Are you looking out for those opportunities? And that brings us to two sources of burnout. And these two sources of burnout are contributors to learned helplessness. And when we're looking at, as healthcare providers, what we face, trauma is a very real part of our job. Whether you're an allied health professional or whether you're a nurse, you likely at some point in your career will experience trauma or moral injury, which can lead to trauma. And to start with, we're going to take a look at moral injury, because this is a term that a lot of people aren't familiar with. But there was a famous YouTube episode done by Dr. MD Z-Dog, Dr. Z-Dog. He has a channel on YouTube. You can look him up. This had millions of views, this video millions of views on moral injury. And he says, it's not burnout, it's moral injury. Well, it's a good point, But moral injury is actually part of burnout in the sense of what's causing burnout. It is part of the thing that is, part of the drive that is leading to these three trifecta of factors that make up burnout. And that is because a moral injury is an injury to your conscience and your values. And in a lot of cases, how this may be showing up in your professional career is not being able to give the time to your patients that you want at the very most basic level, not feeling like you're able to give the best care, whether it's because of time or resources or staffing, feeling betrayed or angry or guilty, shameful even, that you cannot provide this care that you want to. That at its core is moral injury. And when that stacks up over time, because we know in healthcare, we're frequently faced with a lack of time for patients, a lack of time for doing the care we really want to give, a lack of resources, moral injury may be something you experience daily. And as it stacks up, you may feel less and less capable of really accomplishing the kind of care you want to provide, or feeling that you're effective in giving the care you know your patients really need. So I want to take a moment here to have a moment of self-kindness, because a lot of us work our butts off. Hopefully I can say that. And we don't feel like we're giving our best. We're doing our best that we can, and yet still feeling like it's not enough. But I'd like to challenge that and say that if you could have done better, if you could have given better care, you would have. And there are other factors that are at play here. So for all of you that are watching this, that are here live or that are watching this, I'd like you to take a moment of appreciation for yourself and for all of the work that you have done that without you may never have been done, for providing the care that you did give and prevented more suffering or more missed care if you weren't there. So please give yourself a hug, give yourself a pat on the back. And for this moment, acknowledge yourself for all of the work you have done to get here today. Because this is important. Even if we're never acknowledged or recognized or appreciated by anyone else in our lives, we need to do it for ourselves. Because if you can't do it for yourself, who else is going to do it? You need to be your own champion. And it starts right here. And when we speak about moral injury, we can't leave out talking about vicarious trauma as a source of burnout. And vicarious trauma is a newer term to healthcare workers. It was something that was previously studied in therapists and counselors, but oftentimes in rural communities, especially, where you may get faced with a variety of my apologies here. You may have a variety of situations that you might feel you have the skills to deal with. Maybe you don't. Maybe you're a nurse in an ER in a rural community where you've got 4 beds and 1 other nurse. And if someone comes in with a very traumatic situation, it would be difficult for you to handle it. Maybe you're a community nurse and you are going to a home for the first time. you're not sure what you're going to face. But oftentimes you may face a situation that is challenging, potentially traumatizing. Or as healthcare professionals, you may be exposed to patients sharing with you details of their personal trauma. What ends up happening is, even though you are not the one experiencing the trauma, or even if you are just observing it, feels as if it's happening to you. And it was referred to as secondary traumatic stress. And the impact of vicarious trauma is that it can permanently alter how we interact with our patients, with our clients, and how we're able to show empathy with them, how we're able to express empathy. And in order for vicarious trauma to occur, there tends to be three main requirements. You have to be empathically engaged. You have to have been exposed to some kind of traumatizing event or material, which includes exposure to human cruelty. And you may be experiencing a reenactment of trauma if you are a nurse, perhaps, who does counseling, or you've been part of a team who's done a debrief process. You may almost experience, have an experience where you're going through the trauma again. And when we experience vicarious trauma, that profound world change affects our individual sense of spirituality, our worldview, and our self-identity. And we have a nursing colleague in Australia who spoke at the summit I held in July, who spoke about vicarious trauma at length. And the story she shared about how it was showing up in her life was very impactful. She was an ER nurse, and they had a young man come in who had been bike riding, and he was injured. And he had been wearing his helmet, and despite everything that they did, he ended up dying. As a result, over the next ongoing weeks, she noticed she was having arguments with her teenage son, who was a normal teenage kid, but his mom was becoming overly protective. And all she could think about when she looked at her son was this kid that had ended up in the ER and had died despite using safety measures. So every time her son left the house, she would get into an argument with him about where he was going and worried about his safety. And this impacted her for weeks and weeks before she realized that she was carrying through a situation that had happened at work. And she was feeling like, because this had happened to this young man who had died in her ER, that her son was going to die. Fortunately, she recognized that she needed support and she needed help in dealing with this experience she'd had as a health professional. And she reached out and she went into counseling. And thankfully, now we have an amazing advocate on vicarious trauma and a speaker. She speaks globally on this topic. I'm happy to, if anybody is looking for information specifically on vicarious trauma, I'm happy to share her details. But now I want to share with you some techniques that you can use if you have been experiencing any of the things we've talked about so far today. And the first thing to keep in mind is caring for yourself. And I'm really well known for spreading the saying, fill up your own cup first, because the number one risk of burnout is not taking care of yourself, not getting enough sleep, not eating healthy foods, not exercising or getting out of the house. Very simple practices can sometimes be the ones that safeguard us the most. And so when we are carers, as we find ourselves in health, as health professionals, there's a temptation to give from inside our cup and give to everybody else around us, our family, our patients, our coworkers, our employers, the neighbor down the street. Everybody gets from inside our cup. And what happens when we do that, the cup is empty. And when I need something, there's nothing for me. Which leads us to resentment, anger, frustration, increased anxiety, feelings of stress, overwhelm, because there's nothing in our cup for us. When we focus first on doing whatever it takes to fill up this cup, and we keep filling it up, what happens is the cup starts to overflow. And as the cup overflows, we have more abundance to give to everyone else, even more than was in the cup, because the cup was first full. So schedule one thing a week that is just for you. This is my encouragement, and really hope this is something that you can put into practice. It doesn't have to be big. It can be a small thing, but at least 30 minutes per week. A meaningful activity. So not playing a game on your phone, unless that game is life-changing for you, but a meaningful activity once a week for 30 minutes. This could be going for a walk, going in nature, doing some nature bathing. This could be going to a yoga class. This could be cooking a favorite recipe you just love to make, makes you feel good and full inside every time you make it. This could be reading a book, getting a massage, getting your nails done. Never, male or female, never overestimate the value of a manicure, pedicure. Having someone else rub your feet. But one thing for at least 30 minutes a week. That's not for your husband or your partner or your children or your coworkers. It is just for you. Date night with yourself. And then on top of that, 30 minutes a week, 15 minutes a day. Everybody has 15 minutes in their day to dedicate to themselves. This may need a little bit of schedule planning, but I know you can do it. Because that 15 minutes for the day can change your entire day. It can be in the morning, or it can be at night just before you go to bed. It can be at lunchtime, it can be wherever you can fit it in. But those 15 minutes can make the entire difference in how well your day goes. Perhaps it starts with a few minutes of meditation, or putting on your favorite playlist, or dancing around your house. Whatever is going to light you up, make you feel light, make you feel joyful, introduce fun. Anything you can do for 15 minutes that build you up. Listen to a podcast, listen to a book, put on a comedy show on YouTube. Whatever is going to make you feel good for 15 minutes every day. I encourage you to prioritize this. This is all adding to your cup. Another thing you can do is schedule in with your partner one thing a week. Could be, if you don't have a partner, with your best friend. Or it could be an outing with your family or friends. One thing a week that helps you to socially connect with the ones that you care about the most, where you get to spend quality time. And if you're someone who has an extremely busy schedule and you want to say to me, Tessa, I just don't have the time, I would challenge that. But I would say do it every other week, at least every other week. Put on your schedule, the same as you put your work shifts on your schedule, a time with your partner for date night, a best friend date night, a social night, where you can connect and have quality time with the people that are important to you. Because these are the little things that help to reduce the stress in our life. And if you have children, a tip for your children to help you have greater bonding time, which helps you to be more resilient, is to schedule an activity of 60 minutes per week that you are completely focused on your child. 60 minutes per week of dedicated time for that kid, for each kid. You might have to juggle the schedule a bit. You may have to shift some things around. But if Johnny knows that every Thursday between 6 to 7 or 7 to 8 is his time with you, not only will you know you have bonding quality time with your child, but your child will know that they have your utmost focus. This isn't time where you're on your phone or you're on your laptop. This is dedicated time to your child. Per child, 60 minutes a week on the schedule, because your kid's going to know, oh, that's mommy or daddy and me time. If you can do it for each parent, bonus. But at least for you, 60 minutes of quality, dedicated time for your child every single week. And if you can do at least 15 minutes per day, you'll be surprised and shocked in just a few weeks how much closer your children feel to you and how much closer you feel to them. We often underestimate the value of focused attention and how good we feel when we are the object of somebody else's focus and attention. So when we're looking for ways to reduce the impact of stress on our bodies, on our minds, on our hearts, in our lives, filling up our cup needs to be top priority. And here are some simple ways that you can do that. Another thing that is not, it's gaining speed, but I don't think it's talked about enough, is mindfulness. And mindfulness and meditation are not the same thing. Meditation is focused attention for often a specific period of time using a specific method. Whereas mindfulness is about being present in the moment. When we are anxious, or when we're afraid, or when we're in the stress response, mindfulness is the last thing on our mind. As healthcare professionals, we spend about 95% of our days in a sympathetic nervous state. We're in our sympathetic nervous system. The reality is our bodies were only meant to be in that state for about 5% of the time. Can you imagine having to run away from a lion 95% of your day? We would never have survived. And so throughout our day, any chance we take to induce the relaxation response, our parasympathetic nervous system, is going to increase the resources we have available by the end of our day. In a very, very simple way to pull ourselves out of the stress response and into the relaxation response is just tuning into the present. Taking 60 seconds every hour or through multiple times through your day whenever you have the opportunity. Maybe it's every time you come out of a patient room. Maybe it's just when you sit down to chart. Maybe it's in between, if you're working in a clinic, maybe it's in between patients. Just taking 60 seconds to tune into the present. And you can tune into the present in a number of ways. I'm going to give you a few here today, but a very quick and easy, simple way is to just tune into your breath and actually feel the breath going in and out of your body. Just tuning into that one act and bringing yourself present and taking deep belly breaths. It's going to induce our relaxation response. Now, if you're someone who cannot tune into your breath, I've had a few individuals who ran into this with, I would encourage you to pick one of your other 5 senses to tune into. That could be putting your fingers together and tuning into the feeling of your fingers touching and focusing on that feeling for 60 seconds. This could be tuning into a specific sound. Maybe there's a bunch of sounds going around you, but you pick one sound and you focus on that one sound or one smell. If you have a very good sense of smell, perhaps this is a better one for you. But tuning in to one of your senses for 60 seconds and pulling yourself into the present. If we do this throughout our day, even when we're not working, what happens is we spend less of our day in our stress response. And our stress response is energetically very expensive for our body. There's a high cost to staying in the stress response for extended periods through our day. It uses a lot of our body's energetic resources. So the more that we can pull ourselves into the relaxation response more frequently through our day, you'll actually find yourself going home with more energy. Dr. Scott Mills is a researcher, neuroscience researcher, and he has a history as a social worker, as a speaker on resilience. And I spent some time with him this summer. He talked about something called the Pns Wave. And the Pns Wave is something that you can do. It's a technique you can do in just a few minutes to move yourself from a sympathetic nervous system response of fear or anxiousness or rapid thoughts, racing thoughts, to a calm, relaxed parasympathetic nervous system response. And all you do in this is you just wave your hand from just above your collarbone to your lower dantian, which is just below the navel. And you're actually physically tracing the path of the vagus nerve down your body. So just from your collarbone, just gently dragging your hand down to just below your belly button. And you can even add an affirmation or a positive statement when you're doing this to help shift the way you're feeling. And his favorite affirmation that he shared with us is notice the breath breathing itself. And you're just going to slowly take full breaths as you do this for just 2 to 3 minutes. So you can tune into your senses, or you can just use the Pns Wave. There are 2 ways that you can tune into the present. So I want all of us to just take a moment here and just try this Pns Wave. Take your hand from your collarbone and just gently drag it down your body to your belly button while you take nice, slow, relaxed breaths, full breaths. And see how you feel after just doing this a couple times. It's interesting. I do this so often that my body right away after the first wave just starts to relax. And the great thing is when we use these techniques over and over and over and over again, we're conditioning our own minds. And it's like a little switch. You might be able to do just one wave after doing this for a few weeks, and already your body starts to relax. And you may notice this, that it's very difficult to be anxious or to be stressed when your body is physically relaxed. So I challenge you to do this, to try these two techniques when you feel yourself entering the stress response throughout your day. You know, when that feeling of your heart rate's increasing, maybe your palms or your feet are a little bit sweaty, maybe your mind is racing, you notice your breathing is more shallow. Whenever you start to notice those physical aspects of the stress response present, I challenge you to try one of these two techniques. And by all means, contact me and let me know how it's gone. Let me know what's worked for you, what hasn't worked for you, and let's have a chat about it. And the last thing I want to share to really help you prevent burnout, to help you to come out of burnout, to recover from it, to start that journey, is the power of rituals. And it's about how we can start our day and end our day in the best possible way. And I call it the start of shift routine. And it's basically how to start your day without the 3 cups of coffee that I know some of us like to drink. I know at my peak of burnout, I was doing about 3 cups of coffee a day to keep myself alert, to stay on the ball and ready to go. And I wasn't realizing I was actually putting myself into adrenal fatigue. We're not meant to be in a excitatory state for the whole day, as I've already talked about. So if you are a heavy coffee drinker and you love that caffeine, or you need that caffeine, this might be something that can help you to maybe reduce a little bit of that, to support you to start strong without needing that hit of caffeine. And really, what a start of a shift routine, and this is something you would do specifically on days that you work only. You create a very short routine. And what this does is acts as a switch in our minds that the workday is starting, and it puts us into work mode. Now, this does take some time to program, but I'm going to give you some suggestions on how you could do this in your own life. This is a routine you don't want to be more than 5 minutes. 3 to 5 minutes tends to be a very good routine for most people. And we want to keep it simple. 3 to 5 steps. And the reason we need at least 3 is we are creating a pattern that every time this pattern plays, we trigger a response in our brain and in our body. This is something that is part of our life every day in a lot of our daily habits. And a lot of our daily habits may not be serving us, but this is where we can create one habit that absolutely will serve us. And here are some suggestions of what this may look like for you. You can start this if you're someone who drives to work, which in Newfoundland, a lot of you are probably driving to work. So when you get in your car, you can start this routine. If you take public transportation, you could do this right before you get out the door. Or if you're someone who has an area at work where you have a changing room, or you have lockers or a little space that you can kind of get ready for work, that might be a good place to start it. And all you're going to do is pick 3 things you can do consecutively, one after the other, in 3 to 5 minutes, that will be the sign for you to go to work. So an example of how I've done this with clients is one client that I have, she did have a locker at work. She would take her uniform to work, and her uniform would be folded. And step 1 of her routine was taking her uniform out of her bag, unfolding it, and putting it on. Step number 2 is she would sit for 30 seconds and be mindful. She had a mindfulness practice where she would sit for 30 seconds after she put on her uniform and she would ground herself. She would breathe deeply and focus on her breath. And then the last thing she would do is she had a mantra, affirmation, a power statement. You may have heard some of these around. It doesn't really matter what you call it, but the point of the statement was the last step of the trigger, the flick of the switch. And for her, she chose the statement, it's time for work. I'm going to have the best day. And this statement, you really want to craft something that's going to indicate what you're doing with the purpose of it. You're starting your day, you're starting work, you're starting your shift, and what you want to get out of that day. What would the best day feel like? And pull that feeling into the statement. So there's an example of how you could create a routine with just 3 steps. Her routine was probably even less than 3 minutes. And that is a powerful way for you to create a habit in your brain that when I go to work, I don't need coffee because my mind knows I'm ready to go. I've done my start of shift routine. This does take some time to implement, like any habit. It's going to take, on average, about 2 weeks of doing it every single shift to really start seeing the impact. But it's something very simple and very easy for you to implement that requires, 10 minutes of brainstorming, perhaps, for you to come up with your whole routine and then give it a try. After 2 weeks, you're not really feeling the impact. Maybe you need to tighten it up. Maybe your steps need to be smaller or shorter, or they need to be more impactful for you. And then when we're going home, how to turn this off so we don't take our stress home is we create an end of day routine. Oftentimes, we want to do this backwards. What we've done in the morning, we do it in reverse. So we say a power statement, the day is done, I'm going home, my work is finished. 30 seconds of mindfulness, take off your uniform, refold it, and put it in your bag. So that's an example of how we can do our end of shift routine. And then the last thing that we can do when we're going home, especially if you're someone who you find yourself taking your work home with you all the time, or if you're having difficulty getting to sleep at night because your mind is racing with your day and you're having a difficulty shutting that down, the end of day routine will be essential for you. It'll be one of the biggest differences in your daily practice in not taking your work stress home. And if you're ready to go to sleep and you're having challenge relaxing your body, it's very difficult for us to sleep if our body isn't relaxed. I wanted to share something that I use, which is a progressive muscle relaxation. There's a number of quality videos you can find on YouTube for free to do this. I find 10 to 15 minutes is usually best. And you can play a progressive muscle relaxation video, and it will guide you through how to relax your body and ready it for sleep so that you can get a good quality night's sleep. And we can eliminate one of those factors of burnout. And with that, I'm going to turn it back over to Wanda and allow her to, I'm going to stop sharing my screen here and rejoin everyone.
Okay, well, thank you so much, Tessa, for that great presentation. I know on behalf of myself here at the College of Licensed Practical Nurses and Janine and Lori and Alice at the Newfoundland Labrador Council for Health Professionals, we're very thankful that you were able to provide this information to all of our health professionals practicing here in Newfoundland and Labrador. So I'm just going to stop the recording here, and we'll open it up